like a sedative, hypnotic, just before the, a tablet, and they will calm down.
Okay.
And they can take it.
Now let's go for situational type.
Yes. So most common is bridges and elevators and flying. These are the commonest ones. So people who are afraid of going over the bridge, they take a longer route so not to go over bridge. طبعا in Kuwait we don't have bridges, long bridges or rivers, but in the countries where they do, patients take a long route just to avoid crossing these bridges. Flying phobia is quite common, and it is some people, some known celebrities have flying phobia, players or actors, so they only travel by car.
Which take long trip, to
a long trip.
Cross countries, right?
Yes. So for flying phobia, I simply advise my patient to take benzodiazepines before the trip. I mean these sedatives, anxiolytics. 2 hours before the trip, on each way, when flying and when coming back.
When coming back.
And take
Not when they are arriving to the country, because
no,
the fear is when it's takeoffs, right?
It's takeoff and landing, but the medication is has its effect for 6 to 8 hours.
6 to 8 hours.
So they don't need to take more.
Okay.
I mean, if it's a longer trip, then they might. I mean, if it's a 14-hour flight, then they might take it 2 hours before the flight and 8 hours later.
8 hours. Okay. Now let's talk about what you mentioned about social phobias.
Yes.
A problem from meeting people, as I give example, but you mentioned
this is actually social phobia.
Is it common?
It is common actually. So these people want to be with social settings with others, but they feel reluctant to be in this meeting or gathering for fear of being humiliated or embarrassed. So they avoid going to these social meetings. Or it also applies to people who are at work and they are, say, in a meeting and meeting with maybe their managers or the, higher people in the company or at work, and they are afraid to make mistakes, they are afraid of being embarrassed. This is also called social phobia.
Okay.
So people who are afraid of being humiliated or embarrassed, this is the term social phobia applies to them. So they isolate and they don't feel comfortable and they become really very, very isolated and withdrawn.
What about children who are afraid from standing on in the stages, to do some activities at school because they are fear of people will laugh on them? Is this considered a part of social phobia in children who are not experienced?
Not really. Not really. It doesn't apply to children. It applies to adults who feel this way. But doesn't. I mean, it can happen to children if it is excessive. Okay. I mean, even children, they can go out on a stage and they can. But if it is really excessive and they are really afraid that someone will humiliate them, it does happen. I mean, I do diagnose social phobia in children, but it is less common.
Now, the treatment is similar to other phobias?
Yes. In this case, psychotherapy doesn't really help the patient. So medications, in this case, I think they have a bigger role in treating the social phobia.
What about gradual exposure, like desensitization? Can it work for these groups?
No.
The social type?
No, it doesn't apply to them.
It looks like it can work, but you mentioned that it doesn't. So that's why it's better to go to the consultant or the specialist to get the help rather than trying to do things that he thinks logic and it's not logic. Now, before we talk about one of the anxiety disorders you mentioned is post-traumatic stress disorder, I just want to highlight a few things that, as you know, all the news agents and and in the satellite era that we are living now is showing the latest update about, any news, any war, anything. And sometimes they are showing some horrifying pictures, about, people who are dead people, sometimes blood and things. For adults, it's okay because they can watch things. What about children that can be in the living room or with their parents?
Yeah, I think we really should use our common sense, and it's really unfortunate that it is, what is shown on TV is really more horrific sometimes than actual horror movies, because it is real, it is bloody, and it is horrific what is shown. So, I mean, adults can look after themselves, but I really encourage or recommend to parents that they they really should have a watch on their children, if they are exposed to such scenes on TV, that it shouldn't be the case, because kids are very sensitive. Kids can have nightmares or night terrors when they see such things. So I think we should be cautious about that.
Well, now, we mentioned about horror movies. It's now that the reality is more horrifying than horror movies. But what about horror movies? Even movies, sometimes they show one shot about the bad things that happen, or somebody who's killing somebody else in a bad way. Is it okay for children, adolescents? Young,
adults are, it becomes their personal choice. But for children,
this
again,
one cannot cause anxiety disorders or
no,
phobias.
No, not common for the to cause anxiety disorders. But again, for the children, it's affecting them negatively. That they start having nightmares, and they are, become really tense and anxious, and it is not advisable.
Not advisable. Now, so let's go for post-traumatic stress disorder. What is post-traumatic stress disorder?
Post-traumatic stress is, a condition where a person is subjected to a situation where it is life-threatening, okay, or serious injury, or their physical integrity was at risk. So it can happen in cases of wars, natural disasters like flooding or hurricanes, or it can happen when someone is physically attacked. It can be a physical violence or rape. So, or someone was subjected to a hijack in a plane, and the hijacker was pointing a gun to their head. That can be quite threatening to the patient, to the person. So these horrifying experiences, or these experiences where really a threat was so serious, so severe, will produce symptoms of post-traumatic stress disorder.
And what kind of symptoms they can show?
Okay, so for post-traumatic stress disorders, there are three groups of symptoms that happen. The patient can re-experience the event. So we'll talk about someone who was in a
like in hijack.
In a hijack, okay. So he or she will have recurrent intrusive recollections about the event. Will have recurrent distressing dreams, nightmares, acting or feeling as if the event is actually happening right now. She will be sitting in the office, and all of a sudden she feels like the
short point to your head.
Yeah, the kidnapper or the hijacker is standing next to her. Intense distress when exposed to cues resemble event. So when they travel on a plane, they might feel
it will happen again.
They will feel that, okay, I'm sitting on a plane now. So that whenever the situation, so for people, example, who were tortured during the invasion, if they were tortured, for example, in a specific location.
Like in a school.
In a school.
Some of the schools to torture people.
Okay, so whenever they go by that school, they will feel, they will re-experience the symptoms. So one group is re-experiencing. The other group of symptoms is avoidance symptoms. And the avoidance is that when they avoid thoughts and feelings that are associated with the event. They avoid activities or places, like I mentioned. So there is a school.
They want to avoid it
they will
because
avoid
they will
the school.
recollect the event again.
Yes.
Exactly.
Funny enough, the inability to recall important aspects about trauma, something that was so, significant in trauma, they don't recall. This is part of the avoidance that they try to block. They don't want to re-experience it. Diminished interest in activities. They become disinterested in doing their, daily activities. They become kind of numb. Feeling detached from others. Again, this is a long-term consequence. Loss of ambition or motivation. They are not interested in their career or family. So this is the second constellation of the symptoms, which is the avoidance. The third one is increased arousal, which means that they are more, alert. They have difficulty falling asleep. They are irritable, so they easily get angry, and they get outbursts of anger. They have poor concentration. They are hypervigilant, which means that they are, watching, if there is something is going to happen. And they have exaggerated startle reflex, which means that they can't tolerate loud noises. If a door slams, we may just react normally, but for these patients, they react to it in a negative way.
So what you mentioned is a lot of things that really can affect the daily life activities that for any normal person.
Yes.
How you treat them?
Well, these patients do need some sort of psychotherapy to deal with the trauma, to deal with the event, and they do need medications to help them sleep. They do need medications to reduce the anxiety and the depression that they might suffer from, and they need quite a regular follow-up.
Okay. So the best thing to see a psychiatrist,
of course,
to deal with all these things.
Yeah.
Dear viewers, before you go, I would like to remind you that our next week guest is Dr. Hussein Hayati, and he's with us online. Good evening, Dr. Hussein.
Good evening, Dr. Mishal.
Dr. Hussein, would you like to introduce yourself and tell us about next week's topic, please?
Assalamu alaikum. My name is Hussein Hayati. I'm a organ transplant surgeon. I did my training in McGill University in Canada, and I did a fellowship or a specialty in organ transplantation and liver surgery too. And I will be happy to answer all your questions next week regarding the transplantation as a topic in general and the organ transplantation program in Kuwait.
Dr. Hussein, thank you for calling, and I'm sure that will be an interesting topic. See you next week.
My pleasure. Thank you very much.
Dr. Abdullah, thank you for this wonderful discussion. Really, I'm very happy about that you explained to us very important things. Really, do you have any final words briefly to our viewers?
Just to say thank you for having me on this program. I want to tell the patients not to hesitate to come to a psychiatrist for a consultation, because there is help for them, but they need to seek help if they are having any problems.
Thank you. Dear viewers, on your behalf, I would like to thank Dr. Abdullah Gholoum for being with us. If you have any questions, don't hesitate. Our numbers and our fax number will appear on the screen. Dear viewers, thank you for watching us. See you next week and have a nice evening. Good night.